All right. Good afternoon, or I should say good morning to the employees of Milgrom Law. My name is Allie Tom, and I am your guys' health insurance broker. And we're just going to go over some things here. This is going to be more of a brief covering of the plans that you guys are going to have in place for this next plan year starting on June 1st. The plans are all changing just a little bit. This was due just, you guys got a rate increase, about 11% rate increase. I was able to negotiate with United Healthcare down to a 7% rate increase, but to help to control those costs a little bit, we changed up the plans just slightly, just to help with premium costs and bring your guys' costs down a bit. That's part of my job every year is to shop out the health insurance renewal and then also to help you guys, the employees, if you're ever having any issues with claims or that sort of thing, or have any questions about the health insurance. So this is going to be the enrollment form that everyone's going to need to fill out. Please make sure that if you have any dependents enrolling with you, you put their information down here. And then here are the 5 plans you guys get to pick from. And we're going to go over those a little bit more in depth here. So first here is a contact information sheet. My name's Allie. And like I said, I'm your guys' broker. So throughout the year, if you guys have any questions, concerns, issues with the insurance, this is my cell phone number and this is my email number, my email that you can reach me at. I've also included the information for United Healthcare and for your dental and vision insurances with Guardian. If you guys want to make sure your provider, doctor, hospital, whatever it is in network, these are step-by-step instructions for you guys to search for a doctor and see if they're in network. If you guys are keeping the same doctors this year, not moving networks, it won't be an issue. But if you're on a certain network this year with United and you might switch plans, it's always a good thing to go in and search and make sure your doctor's in network. I'm also more than happy to do a network provider search for you guys. So if there's 5 plans total from you guys to pick from. So there's 2 pages that look like this in your employee packet. And we're going to go over them. I've ordered them from least expensive to most expensive in terms of premiums. And we'll go over them. So the first plan option is the Doctors Network. This is going to be your guys' most affordable plan to pick from. And it's also going to be the most narrow plan to pick from, meaning it's a very narrow network. This is for in-state Colorado employees only. So if you're living out of state or if you have a dependent living out of state, you guys will not be able to elect this network. So with this plan, it's a $0 copay for primary care, $100 copay for specialty visits, a $0 always for preventative care. If you have any prescription needs, and if if you're paying a lot for your prescriptions on an HSA plan right now, a copay plan like the doctor's plan might be a good fit for you. So the prescriptions are broken down into tiers. So this $15 copay is going to be for tier 1 generics. The tier 2 is $55. That's going to be brand name generics. $135 is going to be brand name medications. And then that $350 range upwards is going to be for specialty medications. I don't believe there are any employees that fall into the tier 4 category. All of your medications are tier 3 and up right now, based on the claims data I saw. So most of you guys are going to be looking at the first 3 copays here. Mail order RX is always for a 90-day supply, so you get 3 times the amount, and you're going to see that it costs about 2.5 times, 3 times the amount for those mail orders. Urgent care, what I really like about the doctor's plan is they've got $0 copays for urgent care and $0 copays for telemedicine. Emergency room is a $500 copay plus deductible. And then you have these bigger ones like the ambulance, inpatient hospitalization, outpatient treatment, diagnostic labs. Those are all going to be deductible expenses. So you're going to pay out of pocket for these up until you reach that deductible. And then anything after that, you're going to be on 80-20 coinsurance, where United's paying 80% of the bill, you're paying 20% of the bill until you reach your maximum out of pocket. For diagnostic things like MRIs, CAT scans, x-rays, you have a $500 copay. And then outpatient mental health and outpatient therapies like physical therapy and speech therapy, occupational therapy, those are going to be $100 as well. So this plan is a little bit different than last year's. Last year's you had a $1,500 deductible. This year it's going to be a $2,500 deductible. with 4,000 out-of-pocket coinsurance, so that 80-20 coinsurance that I talked about. And then you have a maximum out-of-pocket of 6,500. So once you reach this, United covers 100% of any claims that you have, including, co-pays for prescription drugs and those things. That's the individual amount. If you have any dependents enrolled on the plan with you, you have a $5,000 family deductible with a 13,000 maximum out of pocket. There are no out-of-network benefits on this plan. And you're going to see the rates down here at the bottom. These are the monthly total rates. I know Milgrom Law contributes towards the employee rate. So go ahead and check with Chris to see how much they're covering for you guys this year. But just to give you an idea, these are the total monthly rates. These are not the total monthly rates that you are going to owe, because Milgrom is going to be picking up a piece of this for you guys. So option 2, this is on United's Choice Network. The Choice Network is United's nation largest network. So if you have, this is for all employees out of state, in state. If you have dependents living out of state, this would be a great plan option for them. And this is an HSA plan. So if you guys do not have a health savings account opened yet, go ahead and talk to Chris, because now would be a great time if you're going to stay on an HSA plan and you don't have an HSA bank account open. Now would be a really great time to start doing that. You can start funding your HSA via your payroll on your paycheck. So every dollar that you put in, you're saving about 30 cents on FICA taxes. So it's a great tax savings for you guys. And it's a great way to fund your medical account throughout the year, especially if you do have a higher utilization, if you're going to have more claims this year, or if you have high prescription drug use. The HSA plan is a really great way to get some savings and start saving aside money for your insurance needs. So how this plan works is they have co-pays after your deductible. So the deductible on this plan is $5,000. So until you reach that $5,000, you're going to be paying out of pocket for all of your costs. So for primary care and specialists, you're going to be paying out of pocket until you reach that $5,000 deductible. Once you reach that, you guys will have co-pays for primary care and specialist visits. Once you reach your maximum out of pocket of $7,000, everything is covered at 100%. Same thing with prescriptions. They have co-pays that kick in after you meet that $5,000 deductible. Things like urgent care, an emergency room, ambulance, inpatient and outpatient treatment, all of those bigger items, those are all going to be covered 70% after deductible. So basically you're paying 100% out of pocket until you reach that $5,000. Then you're on that 70-20 coinsurance where United's paying 70% of the bill. You're paying 30% of the bill until you reach that maximum out of pocket of $7,000. Telemedicine, the HSA plans have changed this year. It used to be a $0 copay for telemedicine, but if you're on the HSA, it's going to start costing $54. Telemedicine is still a great thing to use. It's going to be more affordable than going to urgent care, and definitely a lot more affordable than going to the emergency room. So telemedicine is a really great first stop if you guys aren't feeling great, have a rash, those types of things that can be done over a virtual visit. So yeah, like we said, it has a $5,000 deductible, then you have that $2,000 coinsurance, and then until you reach that $7,000 max out of pocket, everything after that's covered at 100%. Again, it's ×2 for any family members you have on the plan. So if you have a kid or a spouse on the plan, or have a kid and spouse on the plan, then it's always ×2, and you guys are looking at a 14,000 max out of pocket. There are also no out-of-network benefits. This is the Choice Network. The Choice Plus network has out-of-network benefits, but they're the same networks. So it's still a nationwide network. It's very large. Almost every doctor and hospital across the country is going to take this Choice insurance. So it's not a big deal that there aren't out-of-network benefits, but it's always a good idea to double check that your doctor, provider, hospital, those sorts of things are in network, just so you're not going to get a surprise out-of-network billing. But this is the largest network that United provides, so that shouldn't be an issue for you guys. Option 3, this is a Colorado network only, so only for Colorado employees and dependents. So this is a more narrow network. It is a referral-based network. This is the only referral-based network. It's almost as big as the Choice Network, but it's in Colorado. They are missing a handful of hospitals and providers, but they're pretty comparative to the Choice Network, but it's just a more narrow network. And again, it's a referral-based network. So same thing with the last plan. It's an HSA plan. So if you want to open up an HSA account, this is an eligible plan for that. Same thing, you have the copays after the deductible here. The deductible on this plan is $2,000. Then you're on $4,900 worth of co-insurance until you reach a max out of pocket of $6,900. Preventative care is always going to be $0 no matter what plan you're on. Again, same thing applies with copays for prescriptions after you've reached the $2,000 deductible. And then everything else this is an 80-20 co-insurance plan. So United's picking up 80% after you reach 2,000. You're picking up 20% until you reach that max out of pocket of $6,900. So this might be a good plan. The doctor's plan and the Navigate plan might be a great plan for you if you have prescription needs. If you have a lot of prescriptions, if you're taking a higher end prescription, just know that with this plan, you're not going to have copays until you've reached that $2,000 deductible. But after that, you're going to have very similar copays to this first doctor's plan here. So on the next page, there's two more plans. The majority of you guys are enrolled on a similar plan to option 4. A lot of you guys right now are enrolled on a 4,100% plan. That plan is changing to a 4,250 100% plan. So your deductible went up $250, but it did help bring the premiums down a little bit. But it's the same exact plan. So everything is going to be covered at 100% after you reach that deductible of $4,250. So it's a pretty simple plan the way they've broken it down. The only thing you would have a copay for is telemedicine. Everything else you're going to be paying out of pocket. And once you reach that $4,250, everything's covered at 100%. You don't have to worry about any co-insurance or that sort of thing. So it's a lot more straightforward. This is in the Choice Network. So again, this is the nation's largest network with United. So this is for all employees, whether or not you live in the state of Colorado. No out-of-network benefits on this one, but you'll see that the rates are down here and they have increased slightly. The newest plan with United that I'm really excited to share with you guys, it would be a premium increase for all of you, but it's a really cool plan. So United has added what's called to their Choice Plus network. So this is the same network as the Choice Network, but the plus means it has out-of-network benefits. And then they've also added what's called Surest. So Surest is brand new with United, and it's really, really cool. This plan allows you guys to shop out all of your services using the Surest app. It's still a United health plan, but the term is going to be Surest. And so how this plan works is you guys are going to have sliding scale copays depending on where you go. So if you want to see a primary care doctor, you go into the Surest app and you can search for one, and it will tell you the most affordable place to go for your primary care visit. So the copays range anywhere from $25 to $130. Same with specialists. So if you need to see a specialist, like if you tweaked your knee or something, again, you can go onto the Surest app, search for a provider, put in the search engine what you need, what's wrong, and it will populate a search result showing you the least expensive provider to go to and up to the most expensive. So it's really cool. This is going to give you guys a lot of power to shop out your health insurance needs. Preventative is going to be $0. Here in prescriptions, you're going to see that you have copays. So again, if you're on a really expensive prescription drug that you've been paying out of pocket for on an HSA plan, and you don't know what it's going to be every time you go because you're paying out of pocket, this copay plan would be a great plan for people that are high utilizers of their pharmacy. So again, it's the $20 is going to be that generic. You might be able to find cheaper generics using a website called GoodRx. $90 is going to be brand name medications, and then the $150 is going to be those specialty medications. If you ever have any questions of how your medication would be covered before you select a plan, let me know what medications you're taking, and I can reach out to United to see what cost you would be looking at on the copay plan and where they would fall into. Urgent care is $110, telemedicine $0, and then the emergency room's got a $1,000 copay. Ambulance has a $700 copay. And then this is where you're going to see the sliding scale copays again, is things for inpatient hospitalization, outpatient treatments, diagnostic labs, MRIs, CAT scans, x-rays, mental health, and outpatient therapies. Those are all going to be anywhere ranging from $0 to $8,000. So I have a plan summary that we're going to go over that explains this a little bit better. This plan does have an $8,000 maximum out of pocket, which might spook some of you. But a lot of you guys wouldn't hit that because you have the power now to shop out where you're going to go and get your services done. So even if you had a big surgery coming up, you could shop out that surgery and see, hey, where's the least expensive place to go? And least expensive doesn't mean, bad outcomes. These are doctors that have the best possible outcomes. United has partnered with them. So just because a doctor costs less doesn't mean they're not going to have a good outcome to your surgery or your service or whatever it is. It's just that these providers have partnered up with United on the scale to help bring down costs. So the rates are all listed down here at the bottom. This one does have out-of-network benefits. I don't recommend going out of network. It's going to be really hard to go out of network on this plan just because it is the nation's largest plan and you get to shop for services. So a lot of you wouldn't need this out-of-network insurance anyway. So we're going to go over the Surest plan in depth a little bit more here, but first I want to go over the United Healthcare options for you guys and how the networks work. So this is an overview. So again, the doctors is Colorado residents only. You have to live in these residing Colorado counties: Boulder, Weld, Larimer, Morgan, Broomfield, Denver, Adams, Arapahoe, Jefferson, Douglas, and El Paso. So almost all of you guys live within this area. It's a copay narrow network, but it has, the key features are $0 copays for office visits, urgent care, and virtual visits, fixed copays for prescription drugs, diagnostic screening, and specialist visits. No referrals are required. This plan is ideal for employees seeking predictable costs and lower premiums. The Navigate HSA network is for Colorado residents only. It has a high deductible health savings account eligibility. In the state of Colorado, it does offer 85 hospitals, 35 primary care physicians, and 5,100 specialists across Colorado to pick from. It is a referral network, so you would have to get a referral from your primary care physician in order to see a specialist. This is also HSA eligible. This would be an ideal plan for someone that's wanting to keep their costs low, but have a bigger network in the state of Colorado than what the doctor's network would provide to them. The Choice HSA network, it's available nationwide. This is also an HSA eligible plan. So if you wanted to open up an HSA account, you could talk with Chris. No referrals are required. You get access to a ton of doctors, hospitals. It's ideal for employees that are seeking flexibility and nationwide coverage. And then there's Choice Plus with Surest. This is available nationwide. It's copay based and you can shop for your services. The key features are that you have access to the Surest app for transparent pricing and provider comparison, and it gives you control to control your costs for your services. It also has fixed copays for prescription drugs. It has out-of-network benefits, no referrals are required, and there's no deductible or coinsurance. Coverage begins immediately. So this is ideal for employees seeking flexibility, keeping medical costs low, and nationwide network. So on the next page, the next 2 pages I have go over the Surest. So this is what your phone would look like if you're shopping for services on the Surest app. So this gives you another breakdown of how your drugs are covered and that sort of thing. But on this next page, this is how the plan design would work. So let's go ahead and jump to an example. Say, for example, if you are going to utilize a maternity benefit for this, you can shop out your maternity services, and you're going to see right here that the delivery for a baby is going to be anywhere from $2,400 to $4,500, and you can shop for that on the app. So if you log into the Surest app and you want to say, okay, I know I'm going to have a baby this year, where would be, the most affordable place for me to have my baby? And it's going to give you all of the hospitals and the exact cost of what that delivery is going to cost you and your family. So really, really cool. They have you're going to see down here again that like for advanced tests, cancer, chemotherapy, all these medical infusions, things like that. Again, it's a sliding scale copay. So for advanced testing, you could go to a facility that costs $40, or you could go to a more expensive facility that costs $1,600. But you have the power to decide because the Surest app is going to tell you how much it costs to go to that facility for that advanced testing. So a really cool new plan option. I know it's a little bit more expensive in premiums, but if you're a high utilizer of the health insurance and you want to, shop out your services and keep your out-of-pocket costs as low as possible this coming year, this is a really great plan option for you guys. The rest of the stuff we're gonna go over in a later meeting, but a couple things I want to go over in this video is you do have the capability to shop on GoodRx. So whether or not you're on an HSA plan or a copay plan, if you guys are taking generics and brand name generic medications, going to GoodRx and shopping out your medications a really good option for you guys. It's going to help you save money. And now if you do use GoodRx and you use a GoodRx coupon, it will not be applied to your United deductible because you technically aren't using your United insurance anymore. But this is a great way to save money, especially if you're on an HSA plan. So shop out your medications on GoodRx. And here's a flyer on health savings accounts, HSAs. A lot of you might not have an HSA bank account open yet, but most of you are enrolled on an HSA plan. This is just a really great way to help you guys save. It's a tax advantage account. So any dollar that you put into your HSA via payroll, you're going to save on payroll taxes. If you end up putting money in throughout the year without using payroll, then at the end of the year when you're doing your taxes, you can submit your HSA and with your taxes and get a tax savings at the end of the year. The individual contribution to HSA this year for an individual is $4,300. So you can fund up to $4,300, and for a family, it's $8,550. If you are funding an HSA, just know that you have to use that money for medical services or vision and dental, those sorts of things. And on the back here, it gives you a big overview of everything you can spend your HSA money on. Just make sure you're not using that money on anything else. As a reminder, you guys have dental and vision through Guardian. Nothing's changing at all. So, this is your guys' plan. You have that $50 deductible for anything that's outside of a cleaning of your preventative care. You guys, I'm going to skip to this page. So preventative care is always going to be covered at 100%. That includes x-rays, oral exams, cleanings. Things like fillings are going to be covered at 80%. And then major care for those big ones, dental implants, bridges, dentures. If you have any perio or endo surgery, root canals, those are all going to be covered at 50%. The great thing with Guardian is you guys have an oral health rewards program. So you have a rollover benefit. So if you guys do not utilize more than $500 worth of claims in a year, you are eligible for an in-network rollover amount of $350. So right now you have a maximum claims reimbursement of $1,000, meaning Guardian will pay up to $1,000 for your dental services. If you don't utilize more than 500 of that in a year, then $350 will roll over to your account. So the following year, you will have $1,350 worth of a maximum rollover account. So it's pretty cool. So if you're going in at least once a year for a cleaning and you don't utilize more than $500, the following year, your maximum benefit will grow to $1,350. Vision is staying the same too. Even though it's through Guardian, it utilizes the VSP network. So the VSP network is very large. It's a very large nationwide network. So if you guys have any insurance needs for your eyes, this is a really great one. It's a $10 copay for exams. And then you'll see that you get an allowance towards contact lenses or contact lenses or new glasses. So this is a really great plan. You'll see that the premiums are listed here. And I also have the premiums listed on the packet when you guys fill it out. So yeah, all listed right here. So that's it for now. If you guys have any questions, Chris is going to send out this entire employee packet. If you guys have questions, feel free to reach out to me and I'm happy to answer those for you guys. And in the meantime, I will see you guys probably in another meeting here, not too far away. Thank you.